Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. This is our second episode of a 4-part series on acute myeloid leukemia, or AML. Establishing patient care goals helps providers develop a personalized treatment plan for each patient. Today, we're looking at the care team's role in understanding patients' values, goals, and preferences, and how this can promote shared decision-making. These sensitive conversations can be tricky to navigate, but with the right approach can build important connections and ensure care plans reflect patients' individual preferences or circumstances. It's critical that providers establish personalized care goals in the early stages of AML treatment and continue to check in with patients throughout their cancer journey. Joining us today is Dr. Melissa Loh, Assistant Professor of Geriatric Hematology and Oncology at the James Wilmot Cancer Center at the University of Rochester Medical Center. When should these care conversations take place?
Yeah, so I think the conversation should happen every time when you talk to the patient and their family members, but especially when there is time where a decision needs to be made. So specifically in the beginning, which is when we first see the patient and have to make treatment decision, that's the time where I think it's very important. But every step along the way where even a minor or major decision, understanding what their goals are at that point, how it has changed over time, it's important. So no specific time, I think, is important to incorporate that every time when we see and talk to the patients.
Who should be having these conversations?
I think everybody in the care team should be having this conversation, but of course, specifically the oncologists or the physicians should have it for sure. And then involving the advanced practitioners or the nurses, depending on what the topics are, because some of them may not be comfortable doing certain topics, for example, and then involving both the patients and their family members in that conversation throughout the way.
Should community oncology providers screen for social determinants of health that may impact patients' treatment plans?
That's a great question. So, social determinants of health, I think it should be collected whenever possible. Right now, we're not very good at collecting this data. So, if there's opportunity, just collect those. I think, again, especially in the upfront setting, if you have those in the context of needing to make a decision, having those information is important. But throughout the way, if you have time, you can just collect those maybe by asking or using electronic medical records or paper forms, however you want to collect at this point. As long as you collect them, I think it's good. And then we can think about a better way going forward to systematically collect this information.
Why is it important to engage patients with AML in shared decision-making and personalizing care goals?
So for older adults, specifically with acute myeloid leukemia, treatment landscape has changed quite a bit in the last few years. And generally, we think about treating with either intensive chemotherapy or moderate to lower intensity chemotherapy, and their preferences and goals really make a difference in what we ultimately choose together with the patient and family members. So incorporating that as part of the conversation is very important, because not knowing what is important to them, it's hard to make a decision without that information, because then you don't know what's important to the patient and the family, and the decision that you make, they may experience decision or regret later, and they don't know what to expect. So knowing that upfront and making sure they are aware what the pros and cons are of the different options, especially in older adults with AML, is important.
Thank you for joining the show, Dr. Loh. You can check out the show notes for more resources on shared decision-making in AML and a link to the first episode in this 4-part series. Today's episode was made possible by funding through Bristol Myers Squibb. Follow Cancer Buzz TV right here on this podcast channel so you're the first to know when we release the 3rd episode in this series. For the entire Cancer Buzz TV team, this is Summer Johnson.